Welcome back again, students. We are discussing about the phases of the systole previously. Now let's continue with the phases of the diastole. Okay, already we have seen the three phases of the systole, that is isovolumetric contraction, rapid ejection phase and slow ejection phase. Now what happens in the diastole? You know, there are 5 subphases in the diastole. Now look at here, the first phase of diastole is called as a protodiastole. Okay, what is the first phase of diastole called as? A protodiastole. So I have already told you, this protodiastole, they don't even mention, in books they don't even mention protodiastole. In some books they will likely start the isovolumetric relaxation. So what exactly happens during the protodiastole? Now during the protodiastole, the first important event which I want you to know is the closure of aortic valve. The aortic valve is going to close now. Okay, the aortic valve closes. Now why the aortic valve is closing? See, let's say during slow ejection phase, I have told you, during slow ejection phase, the pressure is going to decrease from 122 back to 80. Because the pressure is decreasing, the ejection of the blood into aorta also happens slowly. Okay, this already we have discussed in the slow ejection phase. Now I am telling you, the pressure right now is, let's say, 80 mmHg. Let's say, for understanding purpose, is 80 mmHg. Now the pressure is going to decrease. Now for the first time heart is relaxing. Okay, the ventricle is starting to relax. When the ventricle is starting to relax, again, when the ventricle is relaxing, the pressure will start to fall. Now the pressure is going to fall from 80 mmHg to 79 mmHg. Let's say, for understanding purpose, the pressure is going from 80 to 79. You tell me. So here the pressure, minimum pressure maintained is 80. Okay, the minimum pressure that is present in the aorta is 80. So can I say something like this? The left ventricular pressure becomes less than the aortic pressure. The pressure in the left ventricle is becoming less than the aorta. So there is a chance that the blood can come back into the aorta, because here there is a higher pressure, in the aorta there is a higher pressure, in the left ventricle there is a lower pressure. So there is a chance the blood can come back into left ventricle. Do you want that? No, definitely not. So immediately aortic valve is going to close. So the place where aortic valve closes, at the phase where aortic valve closes, that is called as a protodiastole. So now tell me, on the left side, the aortic valve is going to close. On the right side, the pulmonic valve is going to close. So the closure of this semilunar valves, is going to cause which heart sound? S2 heart sound. So have I already taught you, the closure of this above valves causes S1 heart sound, and the closure of this bottom valves in my diagram, it's going to cause which heart sound? S2 heart sound. Yes. So tell me, what happens in the protodiastole? Only one event, the phase where aortic valve closes. The phase where aortic valve closes is called as a protodiastole, and during protodiastole, which heart sound is heard? S2 heart sound is heard. Okay. Actually speaking, the aortic valve closes whenever the pressure comes somewhere around 85 mmHg. At that time itself, aortic valve closes. But this is a better way to understand. Okay, when the pressure in the left ventricle becomes less than the aortic pressure, the aortic valve is going to close. Okay, so just highlight the things. Protodiastole, it's the first stage of ventricular diastole where the ventricular pressure falls. Yes, ventricular pressure is falling somewhere around 80 mmHg, 80 to 79, let's say. When the ventricular pressure becomes less than the aortic pressure on the left side and less than the pulmonary artery pressure on the right side. Okay, so the semilunar valves are going to close, causing S2 heart sound. So with this, protodiastole topic completed. Okay, let's see the same thing in the timeline diagram, in our timeline diagram. See here, I am showing the protodiastole. First highlight, here is the protodiastole. This is the phase of protodiastole. During the protodiastole, what happens? Have I taught you the pressure in the ventricle? It's going to decrease from 80 to 79, let's say. Okay, it's going to decrease from 80 to 79. Now during this phase, which valves are going to close? The aortic valve is going to close and the pulmonic valve is going to close, giving rise to which heart sound? S2 heart sound, and that's completely normal. You know, lub, dub. So lub is S1 heart sound and dub is S2 heart sound, lub and dub. Now this S2 heart sound is due to closure of aortic valve. First aortic valve is going to close and later pulmonic valve is going to close. Okay, first aortic valve and pulmonic valves are going to close. Next, after the protodiastole, the next phase that I am going to start is the isovolumetric relaxation. You guys are experts by this time. Isovolumetric, the moment you see about the isovolumetric, means all 4 valves are closed. Nothing comes in, nothing goes out. Okay, nothing is coming into the ventricle, nothing is going out of the ventricle, because all 4 valves are closed. Just now I have told you which valves closed. The aortic valve, pulmonic valve closed, giving rise to S2 heart sound. So now look at this diagram, that is isovolumetric relaxation. See, during isovolumetric relaxation, all the 4 valves in the heart, concentrate here, all the 4 valves in the heart closed. When these valves close during isovolumetric contraction, the beginning of the isovolumetric contraction, the mitral tricuspid valve closed, giving rise to S1 heart sound. Okay. Just recently, the aortic valve, pulmonic valve closed, semilunar valves closed, giving rise to which heart sound? S2 heart sound. Done. So, nothing is coming into the ventricle, nothing is going out of the ventricle. Just ventricle is relaxing, relaxing, relaxing. So, the pressure from 79 decrease it to 70, 70 to 60, 60 to 50, 50 to 40, 30, 20, 10, 5. Like this, pressure is decreasing. Okay, pressure is decreasing. But first of all, how much blood is there in the ventricle? I have told you in the beginning, sir, how much we are filling the ventricle? 120. We are filling the ventricle 120 ml. Out of this 120 ml, how much is going into aorta? 70 ml is going into aorta. Then how much is left over? How much is left over? How much blood is there right now during the diastole? 50 ml. So that is called as end systolic volume. I have told you we are going to fill 120. Out of 120, 70 is going out. So how much is left over? 50. So in both the ventricle, here 50 ml blood is there. Here also 50 ml blood is there. Okay. So this is called as end systolic volume. And the pressure in the ventricle is falling, ventricle is relaxing, so pressure is decreasing. So that's why look at here 70, 50, 30, 10 something like this, the pressure is falling. But during the same time, the very important event is happening in the atria. So what is happening here in the atria? See, the right atria from the superior vena cava and inferior vena cava. Okay, from the superior vena cava and from the inferior vena cava, it is receiving which blood? Deoxygenated blood. So here I am showing the deoxygenated blood. Okay, so ventricles are getting the atria is getting filled with the right atria getting filled with the deoxygenated blood. And what about the left atria? Left atria is receiving the oxygenated blood. Okay, here there is oxygenated blood. The oxygenated blood is coming from the lungs. So when this filling is happening, when this filling started, sir? This filling happens during IVR. With big letters I am writing IVR. So very important. So during IVR, during isovolumetric relaxation, yes, ventricles are relaxing. But at the same time, what is happening? So right atria is getting filled with the venous blood and the left atria is getting filled with the oxygenated blood. Okay. So when ventricular filling happens during the phase of isovolumetric relaxation. Very important. Especially this is very much important when we are discussing about the jugular venous pressures. Okay. So we'll say when the ventricle is relaxing, whenever there is isovolumetric relaxation, there is a venous filling. There is a venous filling of the right atria. That venous filling of the right atria will causes V wave. That we will discuss later in the JVP topic. But anyway, isovolumetric topic, isovolumetric relaxation completed. But you tell me one thing. Here, as the blood is getting filled, what will happen to the pressure here? Increases. So what is the pressure here? Let's say 5 mmHg. Okay, the pressure here is, let's say, 5 mmHg. Okay, 5 mmHg pressure is there in the left atria. Now, what do you think? At the end of the day, the pressure from this 10, it will again go back to 4 mmHg. Now the pressure is going back to 4 because, like, that's the normal pressure, normal ventricular pressure. So now you tell me what will happen. At the end of the isovolumetric relaxation, when the ventricular pressure is decreasing and going back to 4, when the ventricular pressure is becoming 4 mmHg, can you tell me what will happen? Here there is higher pressure, here there is lower pressure. Okay, here there is higher pressure 5 mmHg, here there is lower pressure 4 mmHg. So what will happen at the end of isovolumetric relaxation? The mitral valve will open, tricuspid valve will open, because here there is higher pressure, here there is lower pressure. So now tell me, which valve is going to open? The mitral valve is going to open. So tell me, what is the end of isovolumetric relaxation? At the end of isovolumetric relaxation, okay, which valve is going to open? Mitral valve and tricuspid valve will open. So tell me, once the mitral valve, tricuspid valve open, can you call it as isovolumetric relaxation? No, you cannot, no longer, you can't call it as isovolumetric relaxation, sir. No longer. Because during isovolumetric relaxation, all 4 valves should be in closed state. Okay. So tell me, what marks the end of the isovolumetric relaxation? Opening of mitral valve and tricuspid valve marks the end of isovolumetric relaxation. Okay. So how can we know that these mitral valve and tricuspid valve are opened? How can we know? The opening of these valves is going to cause a sound called as opening snap. Okay, opening snap. So now let me highlight all these points one by one. Highlight. So during isovolumetric relaxation, both atrioventricular valves and semilunar valves all are in closed state. Now the pressure in the ventricles falls without any change in volume. The pressure in the ventricle is falling from 79 to 70, 70, 60, 40, 50, 40, 30. 20, 10, 10 to 5, 10 to 5 to 4, okay, 10, 5, 4, it is decreasing. Once the pressure inside the ventricles, see, once the pressure inside the ventricles falls below the atrium, that is the pressure in the ventricles, let's say 4 mmHg, and in the atrium, let's say 5 mmHg. So whenever there is such pressure difference, whenever the ventricular pressure is less than the atrial pressure, which valves are going to open? The mitral and tricuspid valve is going to open, the AV valves are going to open, giving rise to which heart sound? Giving rise to opening snap, giving rise to opening snap. Okay, so with the opening snap, the moment you hear the opening snap, you can say that isovolumetric relaxation completed. Now let's see the same thing in the timeline diagram. Come to this line diagram. So during isovolumetric relaxation, the pressure is going to decrease from 79 to back to 4 mmHg in the ventricle. Ventricular pressure decreases to 4. Have I told you? So whenever the ventricular pressure is become less than the atrial pressure, which valves are going to open? The AV valves, atrioventricular valves are going to open, giving rise to which heart sound? Opening snap. So right, opening snap is due to opening of mitral valve and tricuspid valve. Opening of mitral tricuspid valves. Okay, done. So with this, we have completed the isovolumetric relaxation also. So can I say something like this? Say isovolumetric relaxation, it begins with which heart sound? S2 heart sound. It ends with opening snap. Okay, isovolumetric relaxation beginning in the beginning there is S2 heart sound, at the end there is opening snap. So I have told you that in some books they don't even mention the protodiastole. They don't even mention the protodiastole. So they can ask a question something like this. S2 heart sound is heard in beginning of the isovolumetric relaxation. S2 heart sound is heard in the beginning of the isovolumetric relaxation, true? Okay. So yes, some books they don't even mention the small phase called as the protodiastole. So you can say S2 heard in isovolumetric relaxation at the beginning of the isovolumetric relaxation. Done. So now tell me, after isovolumetric relaxation, what is the next phase that's going to come? See, we have completed the protodiastole, isovolumetric relaxation. The next phase that we are going to start is the rapid ventricular filling. Okay, rapid ventricular filling. So chalo, highlight here, rapid ventricular filling. Which valves opened just now? Just now I have taught you that this mitral valve and the tricuspid valve, the mitral and tricuspid valve opened. So which heart sound came? Opening snap. Okay, fine, fine. But you tell me, because of the opening of these valves, have I already taught you that the right atrium, it is getting filled with the deoxygenated blood, and the left atrium, it is getting filled with the oxygenated blood. Now, because of the opening of these valves, where do you think this blood is going to fall? This blood is going to fall into the ventricles. So yes, this deoxygenated blood, okay, the deoxygenated blood and the oxygenated blood will fall down into the ventricles. Okay, just because of the gravity, because of the opening of these valves, the blood is going to fall down. So how much of the ventricles are going to get filled? See, ventricles are going to fill now. How much percentage of the ventricles are going to get filled? Almost 70%. Now 70% of the ventricles are getting filled. In the beginning, have I asked you? Already in the ventricle, 70% blood is there. 70% of the ventricles are already filled. Now tell me, from where this 70% ventricular filling is happening? During rapid ventricular filling. Because of the opening of the mitral valve and tricuspid valve, the blood from the atria is going to fall. Okay, it's going to fall into the ventricles. Now whenever the blood is falling into the ventricles, 70% of the ventricles are going to get filled. Tell me, is it active filling or passive filling? This is passive filling. Just because of the gravity, it is falling down. Okay, so you can call it as a passive filling. 70% of the ventricles filled passively during rapid ventricular filling. Okay, so now let me highlight the same things again. Same events. See, opening of atrioventricular valves leading to rapid filling of the ventricles. Okay, leading to rapid filling of the ventricles. So that too passively. How much percentage wise? Percentage wise you can write 70% filling. Okay, 70% ventricular filling is happening. Okay, now look at carefully. This rapid inflow of blood, when 70% of this blood, whenever it is hitting the ventricular walls, okay, when 70% of the blood, when it comes and hits the ventricular walls, it creates S3 heart sound. Okay, it's going to cause which heart sound? S3 heart sound. So tell me, S3 heart sound is due to 70% filling of the ventricles. S4, I have told you, whenever atria is contracting, 30% of the blood will come into the ventricles, it creates S4 heart sound. Okay, now this is S3 heart sound is due to 70% of the blood when it is coming and hitting the ventricular walls, it causes the vibrations in the ventricular walls causing S3 heart sound. and this S3 heart sound, it can be normal in children and pregnancy. It can be normally heard in children as well as pregnancy. It can be heard, it is a physiological in children and pregnancy, but this S3 is also a low pitch heart sound. S3 is low pitch. Okay, it's a low pitch heart sound, which means you can only hear this with the which side of the stethoscope? Bell side of the stethoscope. You can only hear this with the bell side of the stethoscope. That too, this S3 is abnormal. Okay, so it is of course normal in children and pregnancy, but it is abnormal in which individuals? Right. S3 is abnormal. It is heard in which pathological conditions? It is heard in conditions with dilated ventricles. Okay, it is heard in patients who are having dilated ventricles. Tell me, which patients will have dilated ventricles? Which patients will have dilated ventricles? Like the patient who is having a congestive heart failure. The patient who is going into the heart failure, congestive heart failure, maybe because of the myocarditis. Okay, so congestive heart failure or dilated cardiomyopathy. In the name itself, it's there. Dilated ventricles, dilated cardiomyopathy. So in any condition, whenever there is a dilated ventricles, these dilated ventricles are going to cause which heart sound? S3 heart sound. Dilated ventricles are seen with a dilated cardiomyopathy or congestive heart failure or any other reason which is causing the dilated ventricles cause S3 heart sound. Hypertrophied ventricles are stiff ventricles. Hypertrophied ventricles, stiff ventricles causes S4 heart sound. Okay, hypertrophy causes S4, dilation causes S3 heart sound. Okay, next step. Now let's see the timeline. Okay, timeline. Here, look carefully. So during rapid ventricular filling, what is happening? I have told you there is how much percentage filling of the ventricles? 70% filling of the ventricles. Okay, let me highlight here. There is 70% filling. Actively or passively? Passive. So now you understand. See, when I have started with atrial contraction, I have told you 70% of the ventricles are already filled. There is 70% of the blood already there in the ventricles. From where that 70% is coming? During rapid ventricular filling. Okay. So due to this rapid ventricular filling, 70% blood filling into the ventricles, you can hear which heart sound? S3 heart sound. S3 heart sound. Okay. Now, after rapid ventricular filling, there is a small phase called as a diastasis. You can see here the diastasis. What happens during diastasis? See, during diastasis, a very few ml of blood is going from atria into the ventricles directly. The blood is falling from the atria into the ventricles, very few ml. Okay. So this phase is called as a slow filling phase. So right, this is slow filling phase, also called as a diastasis. Okay, diastasis. During this diastasis, the ventricular filling declines. Okay, see, ventricular filling declines. Very less amount of blood is going from the atria into the ventricles. Very less amount of blood. And heart is also, see, completely relaxed now. The atria is completely relaxed. Ventricle is also completely relaxed. So there is the least cardiac motion. The movement within the heart is now very less. So this is the best time to visualize the heart on echocardiography. So this is a single liner question. They will ask you, what is the best time to visualize the heart on echocardiography? The phase called as a diastasis. During diastasis, that's the best time to look at the heart on echo. Okay, on echo, because the heart is not moving, you can have a better picture. So now, slow filling also completed, sir. So slow filling, it's a very small phase where the ventricular filling declines. Now you tell me, 70% of the ventricle is filled now. Next, how much you have to fill? You have to fill the remaining 30%. How that can be filled with atrial contraction. Okay, that can be filled with atrial contraction. Okay, first 70% filling. Immediately after that, again atrial contraction is going to come. So with this, successfully what we have completed, all the phases of the diastole also completed. Okay, the 5 phases of the diastole completed. Again, what are the 5 phases? Protodiastole, isovolumetric relaxation, rapid filling, slow filling, atrial contraction. Okay, again the same events will happen again and again. Now, from this, can I say at the end of the day, can I say some important points like systole is a phase present between which two heart sounds? S1 and S2. Okay, so the phase between S1 and S2. This phase is called as systole. Okay, systole. And from S2 till again S1, one more S1. What is that phase called as? Diastole. Okay, diastole. Okay. So now tell me, in diastole, you have heard two heart sounds. Have I told you? S3 heart sound followed by S4 heart sound. Yes or not? See, even in this diagram you can very clearly see in diastole, which heart sounds are heard? Diastole begins with S2, diastole begins with S2. Systole begins with S1. Okay, systole begins with S1, diastole begins with S2. Now in diastole there is S2, S3 and S4. Okay, that's what I am showing you here. In diastole there is S3 heard during rapid ventricular filling and S4 heard during atrial contraction. So now again there will be one more S1. Again one more systole will begin. So tell me, what is the pre-systolic heart sound? Pre-systolic means systole begins with S1. Systole begins with S1. So what is a pre-systolic heart sound? S4. So S4 is considered as pre-systolic heart sound. Okay, it's a pre-systolic heart sound. Fine. Systole, always remember, systole begins with S1. Systole begins with S1. Diastole begins with S2. Diastole begins with S2. Now, my dear students, let's see all the important points one by one again. Okay, all the important points one by one. I hope you already know this, but just cross checking. S1 heart sound, have we discussed? S1 heart sound is due to the closure of above walls, that is mitral valve, tricuspid valve. S2 heart sound is due to the closure of the bottom walls. What are they? Aortic and pulmonic, the semilunar valves. Okay, aortic and pulmonic valve. Ejection click, ejection of the blood. Ejection click is due to the opening of the aortic valve and pulmonic valve. Opening snap is due to the opening of mitral valve and tricuspid valve. Okay. Next step. S3 heart sound, it is heard during rapid ventricular filling. S4 heart sound, it is heard during atrial contraction. Okay, it is heard during atrial contraction against hypertrophied ventricles. S3 heart sound is also called as a ventricular gallop rhythm. S4 heart sound is also called as atrial gallop rhythm. S3 is ventricular gallop rhythm. S4 is atrial gallop rhythm. Isovolumetric contraction begins with and isovolumetric relaxation begins with. Look at this timeline diagram and tell me, sir, isovolumetric contraction begins with S1 heart sound. Isovolumetric relaxation begins with S2 heart sound. So right. So isovolumetric contraction begins with S1 heart sound. Isovolumetric relaxation begins with S2 heart sound. Yes, we have discussed. Next, end diastolic volume. End diastolic volume are nothing but preload. How much blood you are keeping in the ventricles? Tell me how much blood we will keep in the ventricles? 120 ml of blood we will keep in the ventricles. Okay. And how much is going into the aorta? 70 ml is going into the aorta. And how much is left over in the ventricle? That is called as the end systolic volume. That is 50 ml left over in the ventricle. Okay, na? Fine. So all these are important points. Have I taught you what are the low pitch heart sounds? Guys, what are the low pitch heart sounds? Low pitch heart sounds, look carefully. I have already taught you S3, S4, they are the low pitch heart sounds. They can only be heard with the bell side of the stethoscope. But there is also one more heart sound, that is a tumor plop sound. Tumor plop sound. Even this tumor plop sound, it can be heard with the bell side of the stethoscope. And where you can hear such a tumor plop sound, this is a pathology. The tumor plop sound is heard in a condition called as atrial myxoma. Okay, atrial myxoma. What is atrial myxoma? Atrial myxoma means a tumor arising in the left chamber of the heart. Okay, tumor which is arising in the left atrium. So here is the tumor. So this tumor, what it will do? The tumor, it will come and hit the mitral wall. It will come every time it is coming and hitting the mitral wall. It will cause a sound called as a tumor plop. Okay, tumor plop sound. Okay. Now, tell me, what if this tumor is enlarging? If this tumor is enlarging, it will cause obstruction to which wall? Mitral wall. It can lead to mitral stenosis. Mitral stenosis. So tell me, the patient who is suffering with the atrial myxoma may develop the mitral stenosis. And one more thing, especially the patient who is suffering with this atrial myxoma, when do you think he will have the symptoms? Especially during standing position or lying down position? Standing. Okay, whenever the person is standing, listen carefully. Whenever a person is standing, because of the gravity, what happens? This tumor, it will come and block the mitral wall. So, do you think the blood can go into the left ventricle? No. What will happen to the stroke volume? Decreases, cardiac output decreases, BP decreases. So, there will be dyspnea or lightheadedness. Okay. So, what I am trying to say, whenever the person is standing in standing position, this tumor, it will block the mitral valve orifice, leading to a mitral stenosis kind of features. Okay. So, what will happen to the back pressures? the back pressure to the lung increases, so there will be dyspnea. So there will be dyspnea on standing, there will be dyspnea on standing, okay. So there will be dyspnea in standing. Okay, so there will be dyspnea on standing. So this is very important. This patient, usually heart failure patients, whenever they lie down, they will have the symptoms. They will be having difficulty in breathing. But here, in this patient with atrial myxoma, they will be having dyspnea on standing. Okay, this is called as a platypnea. Okay, this is called as platypnea. So what is platypnea? Platypnea means if the person is having dyspnea upon standing, then it is called as a platypnea. Okay, so platypnea is seen in which condition? Atrial myxoma. Atrial myxoma arises in which chamber of the heart? Left atria of the heart. Atrial myxoma functions like mitral stenosis. It causes which heart sound? Tumor plop sound, which is an example of low pitch heart sounds. Okay, low pitch heart sounds. With this, what we have completed successfully, we have completed all the diastolic phases also. Now here one more point I want to add. See, this opening snap, okay, opening snap are the ejection clicks. See here, this ejection click and opening snap, can you normally hear them? No, you can't normally hear them. They can be heard in abnormal conditions. So in which abnormal conditions you can hear a loud ejection click? If I am using the word loud ejection click, okay, loud ejection click or loud opening snap. See, they are talking about, these are the keywords. If they use the word loud ejection click, they are talking about aortic stenosis. Okay, they are talking about aortic stenosis or pulmonic stenosis. This is mainly aortic stenosis. If they are talking about, if they are using the question, okay, they are giving a long question with 4 lines and they are saying upon auscultation there is a loud opening snap heard. Okay, so the person is having mitral stenosis. So remember, these are like keywords. These are like keywords. Loud ejection click is seen in aortic stenosis. Loud opening snaps is seen in mitral stenosis. So with this successfully, we have completed all the important points about the diastole, 3 phases of the systole and 5 phases of the diastole. Hope the video is helpful. Thank you.